One of the things we like to do on this program is take a look at alternatives to traditional medicine. It's traditional medicine's been great for centuries. We've learned a tremendous amount, continue to, but we shouldn't be ignoring the fact that there are other ways to achieve health, and that's what we're going to do today as we talk with Dr. Caleb Such from Crossroads Wellness Center. Glad to have you here. Nice to meet you.
Thanks for having me.
So we are going to talk about the role of chiropractic and naturopathic medicine. So brief me on kind of the vision that you have at Crossroads and how those disciplines all come together.
Yeah, well, it kind of started for me when about 4 or 5 years ago, I just kept having patients come in with problems that I just didn't have tools to solve. So I commonly say that I was smart enough to know that I wasn't smart enough. and so that really drove for me trying to figure out the why. So trying to figure out why patients were having these particular issues. Why have you gone to so many different physicians and gotten very little answers? And so I went back to school for functional medicine. And functional medicine and naturopathic medicine are very, very similar. But the difference between, say, me and Dr. Harmon, who works with me, she's a naturopathic doctor, so she was naturopathic trained. I was chiropractic trained. They were very similar. We actually we went to the same school and took similar classes, and they really just build well on each other. But it's really the difference between allopathic or traditional medicine and what we do at our office is holism or holistic medicine rather than what we call reductionism, or I'm going to reduce everything down to this one body part or one system, or I'm going to specialize in this area.
Gotcha. So we're treating the body as a whole and trying to maintain wellness and health as opposed to fixing individual problems.
Yeah, it's preventative rather than reactive.
But you can still use these techniques to treat a problem or a condition, right?
And we always do, yes.
Yeah. So tell me more about that. So the thought here is that what the causes of illness in our body are broad and varied, and your approach to those, for example, cardiovascular disease, diabetes, all those things you can treat differently than traditional doctors.
Absolutely.
How is that done?
Let's take the cardiovascular one, because I think that this is probably a good example. Let's say you were at your doctor and you did a wellness check, and you go to your doctor and your cholesterol level is high. Mm-hmm. And so that cholesterol level comes high, and the doctor's going to hand you a prescription for a statin drug to lower the cholesterol.
And they have, yes.
Yes, absolutely. And one of the problems that we have with doctoring is that we've gotten away from what a doctor is supposed to do. A doctor, really what a doctor is he's a detective and a teacher. And so if I, as a physician, get a lipid panel back that has a cholesterol level that's high, and my first answer is, well, let's just lower the lipids by giving you a statin drug, you forgot to ask the question of why is the cholesterol elevated? Because the answer may be that there's inflammation inside of the cardiovascular system, and your body's supposed to raise cholesterol when that happens. And LDL goes up to patch that hole. And maybe the answer is you leave the body alone. It's doing exactly what it's supposed to do. And that's actually one of the examples we saw with COVID, because I believe that COVID was actually a blood disease, not a lung disease. Mm-hmm. And so you see this inflammatory response inside the cardiovascular system where cholesterol or LDL goes up to patch those holes.
Yeah.
And as long as HDL goes up with it, that is an appropriate response. And so the difference is I'm not going to just treat the symptom of elevated cholesterol. I want to ask, why is it elevated? I want to know, why are these certain things happening? And then we really use food to try to help control or restore the system back to what we call homeostasis if need be.
Man, I will just back you up. You are spot on. There is so much evidence that the primary damage of the COVID virus was the epithelial cells that line your arteries.
Absolutely.
So I think you're spot on with that one. So tell me about. So I'm going to change lifestyle. Do you use medications, or is it all food, minerals, lifestyle, that kind of thing?
Yeah. So I don't prescribe any prescription drugs, and neither does Dr. Harmon. So everything that we do is either whole food supplements, herbs, or lifestyle changes, or what we call manual medicine, manipulation, dry needling, red light therapy, hydrotherapy, cryotherapy, hot, cold, all of these things. So that would be the physical medicine side of what we do. And really, Probably the biggest bang for your buck is going to be to change your lifestyle, because America is so bad. We have some of the worst health outcomes for any industrialized nation.
Yeah, that's true.
We have some of the worst food. We have some of the worst healthcare systems. And we are 5% of the world's population. We take over 50% of the world's drugs. That's not good. We have some of the worst health outcomes for mothers and children. More mothers and children die in the first year of life in this country than 30 other industrialized nations combined. We have terrible health outcomes, and that's because we have terrible things, as in food poisons that are going into our bodies. And a lot of it we're ignorant to. We have no idea that that's there. And that's where a team like mine comes in and tries to, teach you and open your eyes to, hey, the things that you've been doing has actually been poisoning your body.
So I have to be a willing participant to cooperate and make some lifestyle changes if naturopathic medicine is going to work for me.
It's the only way it will work, yes.
Yeah. So tell me, what's an appointment like? How is it different than I might be accustomed to?
So it really is that detective and teacher thing. So you're going to come to me with your bucket of clues, right? And they're all over the place, and you don't know which ones connect to what, and that's through history or lab work or imaging or whatnot. And then we go through an exam, and it's my job to try to put these clues together for you, to take all of these clues out of this bucket and say, well, this, and this all leads me to this conclusion. And that's what we've done away with doctoring right now. And I think we actually have to point the finger at the universities that teach the doctors, because we don't teach doctors how to think anymore. We teach them what to think. And so as soon as you get away the how and just give you a recipe, now you're going to do this one size fits all. If it doesn't fit within the reference ranges, then you don't have it, and things get missed, and doctors forget how to treat the person in front of them.
Man, that's interesting. So yeah, in that 8-minute visit I have with my doctor,
yes,
yeah, they're trained to solve my problem and react to that.
As long as it fits inside the reference ranges, yes.
Well, so let's talk about reference ranges. And what you mean there is, if my lab values are, let's say, 150,
yeah,
and that's considered normal, it doesn't matter how I feel, you're normal. So, yeah, maybe that's not a problem, but you're looking at that differently.
Absolutely. And I'll bet a lot of people listening right now have probably had that experience where they have an organic symptom of something. They go to the doctor. The doctor looks at them and says, well, your blood work came back and everything's fine. You're good. It was just anxiety, or don't worry about it. Well, you forgot to ask the why question and to look deeper. You have to actually treat the patients that is in front of you. So yeah, if your reference range is off in your blood work, but it's close to the lower level, and this other one's close to the lower level, and this one's close to the high level, and all three of those things point me to the conclusion that your liver is not doing conversion of a certain hormone or doing detoxification, then I'm going to say, you have a liver problem. We can't see it in your blood yet, but I can see the clues of a liver problem.
Okay. Thanks for setting the stage. When we come back, we'll talk about then what happens. What is the naturopathic or holistic medicine approach, functional food approach to functional medicine approach to dealing with liver problems, type 2 diabetes, and all the other conditions that so many people have and take drugs for every day. And we'll do that when we talk more with Dr. Caleb Such from Crossroads Wellness Center on the Health Call Live Radio Hour on WOWO. And we are back with Dr. Caleb Such from the Crossroads Wellness Center. He is a doctor of chiropractic, also functional medicine, and in the employ of his group is a naturopathic doctor. So we're doing this whole alternative medicine discussion this half hour. And I want to just back up a second and get clear on something. You're not negative on blood tests and that kind of empirical science, right?
No. Thank you for clarifying that. No, they're actually extremely useful. The point that I was really trying to make was when physicians can only rely on the piece of paper or the image and forget that there's a human being in front of them with clues sitting right there in front of them, they really get handcuffed to just diagnosing now the piece of paper rather than the actual person.
Good point. So if you have a question, you can call 447-1190, 800-333-1190, or you can text it 46862, and that's what someone has done. And here's their question. I don't have a name associated with it, but Caleb, somebody somebody's asking, what percentage of ailments are directly linked to processed foods, sugar, and unclean foods? So foods that are touched with antibiotics or pesticides, etc.
All right, I'm going to give you the straight up answer. The largest killers of Americans: heart disease, stroke, diabetes, cancer, Alzheimer's, dementia. All 5 of these are directly related to our food and the processed food and the chemicals that are in them. We are eating poison every day.
And so that is a place that you start when you have a consultation with somebody. You're looking at diet? Are you looking at exercise, I assume?
On our intake form, one of the questions is, tell me what you ate in the last 24 hours. I want to know. What's a normal day look like for you? What's a normal movement pattern look like for you? What are you drinking? What are you eating? It's probably, I don't think I could do my job without assessing that issue.
Okay. So let's say that I come to you with before the break, we were talking about some liver conditions.
Yeah.
You might diagnose a problem with the liver. So what are you going to do for me in that regard?
So really what I'm going to try to do is put together a plan that best appropriates you, something that you can comply with and also you can afford. Those 2 things actually matter. And we're going to try to help promote the body's ability to do something. I'm never going to try to do something for the body. I'm really not treating your liver. I'm trying to promote your body's health of your liver. And we do that actually through food and through movement and through the way that you think and through the way that just your entire life actually depends on how the function of your organs actually work.
So you're trying to remove those things that are causing a problem.
Absolutely. So Lee has a bucket, and in Lee's bucket we have a certain amount of ability to detox. And if you put too many poisons in the bucket, then your body's ability to get rid of, you are going to degenerate and cause disease. And so I'm going to try to encourage you to stop putting things into that bucket that keep causing the issue.
Got it. So if I'm overwhelming my liver and my kidneys and all those other organs that are associated with removing those natural byproducts of whatever I'm eating, then I'm going to have that problem.
Yeah, and you'll get stuck taking pill after pill after pill and never actually improving.
So another question, could you tell a new mom what 2 foods or ingredients are terrible for a child? That's so funny because my grandkids came to visit recently and we had some animal crackers.
Yeah.
And I'm putting them out and thinking, oh my God, these things are just nothing but a sugar bomb.
They are. A lot of the kids' foods are sneaked in a bunch of sugar. Here's my health advice with sugar, or with food. I think it can be made very simple. If it's colorful, you should eat it. So this beige color of, French fries and buns and crackers, these beige colors, these very pale colors, there's very little nutrient density into that. And I'm not talking Fruity Pebbles colorful. I'm talking fruits, vegetables colorful.
Right, yeah.
So if it's colorful, eat it. And if it wastes or rots, you should eat it. If you have something that does not ever perish, there's probably preservatives, there's probably extra additives into it, and it's probably not healthy.
So let me drive you back to that question. 2 foods or ingredients that a child should not go near.
So it's definitely sugar, the added sugared things, which is in a whole bunch of stuff. It's in cereals, it's in snacks, it's in goldfish crackers, it's all of, like you had just said. And the other thing is I really just don't like food dyes. I don't like food colorings. I see a lot of behavioral issues cease once we remove food colorings or dyes and that thing, because they really are chemicals.
Yeah, boy, you've lit up the text line here. Somebody is asking, is your treatment covered by Medicare?
So we aren't in network with Medicare or Medicaid. One of the reasons why we're not is because it's not because of the people who carry it. It's because being in network with that is very, very difficult. They have the tightest hoops to jump through. They have the most amount of audits. They have the most amount of pieces of paperwork, and they pay the least. And so it does not make business sense to be in network with them. They're a big, giant headache. But we accept most major insurances.
Okay. And let's jump back out to the phones. We have another caller here. What's your question for Dr. Caleb Suits from the Crossroads Wellness Center.
Yes, one group of people says you need essential oil for the human body, and one, if you listen to Dr. Wallach on Sunday morning, he says no oil at all. What's your opinion?
Oils are essentially fats. Our brain is 60% fat. You cannot run normal cellular function without fats. Almost every single cell has a lipid layer around it. Those are fatty acids, and oils and production of fat is really dependent on that. I understand that seed oils are really inflammatory, and in general, we should stay away from almost all of them, and that's canola oil, safflower oil, peanut oil, these types of vegetable oil, absolutely. Yeah. But I don't think you can push me into an argument to say that things like coconut oil or olive oil or grass-fed butter are bad for you. I really do not believe so. I think they're essential.
Thank you for your call. Hope that gave you the answer you're looking for. What is the leading cause of high cholesterol, asks another text question.
Well, the total number of cholesterol I really don't care about. I do not care about. This is one of the interesting things. Total cholesterol is really like a thumbprint. Everyone's is very different. And until statin drugs were made and put on the market, the reference range was very broad. It was anywhere from 180 to 350 could be considered normal. Then once we made a drug for it, we started shrinking it down and qualified a lot of people for it, unfortunately. What I'm more concerned about is your HDL to LDL ratio. And ideally, I like that around a 2 to 3 to 1 ratio. For every 2 or 3 LDL I have, I should have 1 HDL. And as long as you're in that reference range, I'm pretty happy.
So what's a naturopathic approach to improving that ratio?
So to improve that ratio, there are a lot of different foods, and when I say phytochemicals, I mean the actual products inside of foods that helps increase that ratio or decrease the inflammatory response inside of the body so that you can lower your LDL down. And we could get there, we could talk for hours on how many foods and which ones do that, but there are a lot of different foods. That's why food is medicine. That's what we try to promote.
And what's the number one clue that a food is rich in phytochemicals? It's bright color,
right?
It's
color, baby.
Yeah, exactly. It goes back to that. Again, another question here. Do you address heavy metal detox, and what roles do heavy metals play in our health?
Man, I got a softball question there. So this is interesting. Lee, you don't know this, but over the last 4 years, I've been collecting hair analysis from mostly children to test for heavy metals. And this was one of the things that I kind of stumbled into, that a lot of the issues that we see in our children's health, which unfortunately over 50% of children, that's 0 to 18 years old, is diagnosed with a chronic disease in this country. That's way too much. And I started testing children's hair. It's not an expensive test. It's not cheap. It's about $120. We do it in our office. It's not covered by insurance. And I have had over 100 children that I've tested under 16 years old, and 98% of them have heavy metal toxicity.
So we're talking about what? Lead, zinc, cadmium?
It's almost all aluminum.
Aluminum. Huh.
So the heavy metals, or would be more appropriately called toxic metals, it's mercury, cadmium, lead, all of those.
So what do you do about that in this naturopathic approach?
So really what I try to do is, again, I use food to try to help the body's ability to do what's called chelation. Chelation is just the fancy word for getting rid of metals. Your body does it every day, all day. And I try to help promote the body's ability to do that.
We've had a real interesting conversation. We've got to leave it there. Time's getting away from us. That is Dr. Caleb Such from the Crossroads Wellness Center. You will find them online at crossroadswellnessfw.com. The office is at 12812 Coldwater Road in Suite 101. Again, that is crossroadswellnessfw.com. Caleb, good to meet you.
Yeah, thanks for having me.
Love to have you back. Let's talk. Let's come back and talk acupuncture and dry needling.
Yeah, that'd be fun.
Okay, well, we'll look at hooking that up in a few weeks.